News 46 is brought to you in part by...
Are you a 3 everyday mom? A significant number of children and adolescents fall short of the calcium they need. Researchers suggest consuming just 3 servings every day of milk, cheese, or yogurt to help reduce body weight and body fat. Milk contributes the most calcium and protein per 100 calories and per penny, making milk a nutrient-rich and cost-effective component for meals. Don't compromise your family's calcium intake, decrease their risk of fracture, and build lifelong healthy habits. Become a 3 everyday mom today. It's easy as 1, 2, 3.
And cold relief products, when you have a cold or allergy, like I have allergies right now, you want to avoid medications that have ephedrine in them, so pseudoephedrine. All of those medications will increase your blood pressure, increase your heart rate, increase your risk for heart attack and stroke, especially if you already have high blood pressure. For certain women, birth control pills can cause high blood pressure. There's the high blood pressure of pregnancy. That is a rare entity, but nonetheless can happen. And hormone therapy, some hormone replacement therapy can lead to high blood pressure. So it's not an uncommon disease state. 72 million people in the United States have high blood pressure. And we know that there are certain traits or habits that cause it, and we could probably all guess them. These are called your risk factors. Just by virtue of getting older, a male is greater than 45, a female is greater than 55. And unfortunately, though, now with the epidemic of childhood obesity and earlier diabetes, we're seeing people in their 20s with very difficult to control high blood pressure, but generally, it's as we get older. Over half of all Americans age 60 have high blood pressure. But it doesn't have to be a routine part of getting older, and it certainly doesn't have to remain high, because there's a lot of things we can do to keep it at a normal level. Race and ethnicity also play a role. African Americans have higher rates of high blood pressure than Caucasians or Latins. And they tend to get high blood pressure earlier in life. A lot of reasons for that. It's often more severe. They're less likely to be aware that they have it. They have more difficulty achieving blood pressure control. We actually know now that there are some medications that don't work well in that population, so we have to tailor blood pressure therapy for everyone, but especially for different ethnicities. And they tend to have higher rates of premature death and complications from heart attack and stroke. If you're overweight or obese, you're at risk for high blood pressure. Overweight means that you have excess body mass, either from muscle, bone, or fat, where obesity just means you're overweight from excess fat. So there is a difference. I don't know if it's an important difference, but there's a difference. Gender, men, we're lucky. We're much more likely to have high blood pressure than women. Women are better at finding out that they have high blood pressure and getting treatment up to the age of 59. Turns out once women get to the age of 60, they're just as likely as men to be treated or be aware that they have high blood pressure. But if they've got to the age of 60 and they haven't been diagnosed yet, they're harder to treat because it's likely that they've had it for a longer period of time. And the longer you have it and it goes untreated, the more difficult it is to get under control. So unhealthy lifestyle, bad habits, that causes high blood pressure. And salt is the enemy. Okay, so you're going to hear me talk a lot about salt. Salt causes fluid retention. Fluid retention, the more fluid in your body, the more blood pressure you have. So if you have high blood pressure, eating too much salt is a bad thing. If you don't have high blood pressure, eating too much salt can lead to it. Drinking too much alcohol. Some alcohol is good, too much is bad. And not getting enough potassium in your diet. I don't want anyone taking potassium supplements unless your doctor gives them to you, but eating vegetables, eating those things that have potassium in them should keep you at a normal level. Lack of physical activity, sedentary. There are things called hypertensive emergencies and urgencies, and those are, if you get a severe headache, if you get vision changes, those are things to get to an urgent care or an emergency room to get checked out, because that's extremely high blood pressure and that's dangerous, but that's rare that happens. What can it lead to? Well, there's a lot of complications that high blood pressure can cause. Heart failure. Heart failure just means fluid leaking into the lungs because there's either a problem with the strength of your heart pump or the heart pump is too stiff, like the large aorta, the large blood vessel of your heart, of your body, any of your organs that have arteries. So basically it can happen anywhere. And then also certainly leads to heart attack, stroke, kidney failure, and some people can end up with amputations of limbs because what happens is as arteries narrow, they limit blood flow. I'm going to do a talk in July on coronary disease as kind of a follow-up to this. And how coronary disease happens from blood pressure is that those before they come into their appointment with me and their blood pressure will be up. But you don't want to do that for at least 30 minutes. You want to go to the bathroom before you have your blood pressure measured. A full bladder will cause your blood pressure to go up. And you want to sit quietly for 5 minutes before that blood pressure is checked. So if you go to your doctor and they rush you in, they take your blood pressure and it's high and they want to treat you, say, take it again, because I've been sitting here now probably at least 5 minutes waiting, and it'll probably be down. Unless you're waiting too long, then it'll be really up. But happens sometimes. Yeah. All right, so treatment for blood pressure, lifestyle changes and medicine. Lifestyle changes are probably the best thing you can do. There's nothing we can do for you medically that's going to be better than what you really can do for yourself through lifestyle modification, but those are hard things and we understand that. So medicines are a necessary part of the treatment. Goals of treatment are to keep your blood pressure below 140/90. We like to say keep it at the 120/80 level now for most people. And if you have diabetes or chronic kidney disease, we want it even lower than that. So DASH. DASH is a dietary approach to stop hypertension. And that's a healthy eating plan. And it focuses on fruits and vegetables, those high potassium vegetables, whole grains, and other heart healthy foods that are low in